Healthcareonomics, changing healthcare by changing the way you think about healthcare. Hi, everybody. Welcome to Healthcareonomics. I'm your host, Dr. Kevin Wacasey, and this is Healthcareonomics for Employers, episode number 6. My, how we're getting on with these. Today, my guest is Raul Ramirez. He is with Gulf Breeze Benefits in Gulf Breeze, Florida. That's in the lovely Pensacola area. And I want to mention before we get started, Raul, that basically we're covered here. We're appearing now on several different venues. Healthcareonomics, the podcast, is available on iTunes and SoundCloud. We're also available on Mike Church's Crusade channel. If you go to crusadechannel.com, you can catch us there on Monday evenings where Mike broadcasts an audio version of the podcast. And of course, as always, I would ask that you like this video if you're watching it, and please subscribe to the Healthcareonomics YouTube channel. I also maintain a blog at healthcareonomics.com. Okay, that's probably all I'll mention Healthcareonomics in the podcast this time. But Raul, I want to thank you so much for coming on. You and I have talked for quite a while now, and getting our schedules together to have this happen was kind of took a little bit of effort, but we finally got together, and I'm glad you're here. So tell us a little bit more about yourself and what you're doing out there.
Well, just like you said, with one correction is I'm Raul. A lot of people know me around here as a musician as well, but right. I'm the owner of Gulf Breeze Insurance. Also do all the benefits for All Staff Payroll, which is a full service payroll company, and been in business. Been doing in the industry since '98, but business as Gulf Breeze Insurance since 2005. So, what is it now? 2019.
Yeah.
I'm only 32, which is great. So it's been awesome. I'm a musician, and a lot of people, it's just great. It's great. It's great to be alive here in the Panhandle of Florida. It's warming up. The temperature's 70 degrees now. The water temperature is 70 degrees. The AC kicked on, and
we haven't quite gotten there yet in Texas, although it was 45 degrees this morning. It was 92 here a couple of days ago. So I love springtime, except for my allergies. They're starting to kick in, of course. Physician heal thyself, right? But the summertime around here gets to be a drag. So I might bop down there this summer and visit you near the breeze, near the Gulf Breeze.
Well, do that, because actually I'm originally from San Antonio.
Okay, all right. So you know about Texas heat.
Yeah, so my family's still in San Antonio, but it's always great because whatever weather you guys get, it always hits us a day or two later. So
True.
So thanks for telling me it was 42 degrees. That's awesome.
Well, so tell us a little bit about what sets you apart. You and I hooked up on Twitter. Maybe hooked up is not the greatest term, but we met each other through Twitter, and you started following me and liking my stuff and retweeting my stuff. And being an employer benefits broker, and being what this podcast series is all about, is employer benefits brokers who think outside the box, who are trying to do this an alternative way, because I think you, like most of my other followers, and certainly myself, see that the health insurance industry, what was it you said before we got started recording? Health insurance sucks. Okay. So why don't you tell us a little bit about that?
Well, I didn't know, since you said it was on, a church podcast too. I didn't know I could say that, but it does. It's a mess. But that's one thing I like about it. It's always changing. So I'm always reading. I'm always learning. Always learning new ways around it, and so to speak. And being full service is I have other avenues that I am able to present to employers to combat the craziness, the infringement upon what they have to do. You probably noticed me on Twitter more most times is I do not like when people are made to do something that they don't want to do. That's legal, of course.
I second that. Yeah, I second that.
So that always sets me off, and to be honest with you, it sets off about 99% of the employers that I talk to on a daily basis. That's just the way it is.
Yeah.
So it also, it affects me in business wise, as far as the expansion of small business, which I can't believe they even call small business, as far as 50, a 50-man group is not the same as Darden Foods.
Yeah.
But they're almost lumped in the same parameters as they are.
Yeah, there's
So,
nothing small about the regulations that affect a small business or the taxes that the small business has to pay to keep its doors open. So, yeah, having had a small business or two myself, I can certainly attest to that.
right. But you know what? I use humor a lot. I have fun with it because in the world we're in right now, where everything's so politicized, and this is a very conservative part of Florida. It's probably one of the most. We're always the last to be called during an election. We're the forgotten. The Panhandle is the forgotten area of Florida.
Right.
Half people don't even know we're on Central Time.
Right.
Because they go, "What? You're in Pensacola? It's almost 3 o'clock there." I said, "No, it's almost 2." It's like go look at. I mean, time zones are crazy anyway, but so so I'm dealing with a lot of conservative employers as well. That are feeling the brunt, feeling the pain, I guess,
Yeah.
so to speak. That's when a government entity is telling you what you have to do, and you choose, what, I'm not going to open up another store.
Yeah.
You know, that's
Or I'm not
usually
going to expand my employee population.
exactly.
Yeah, yeah. So I wonder, you make an interesting point here, and I just wonder, do liberal employers, do liberal business owners, do they really mind paying for all this nonsense too? I mean, or is it okay with them to pay for it?
It, it, it's not. I mean, it's funny because
Of course not.
we always hear some of the larger employers such as Amazon and stuff like that. They're liberal, owned by liberal leaning, or do we really know if they are liberal leaning, or it's just
Yeah,
what they're playing to the cameras?
right,
Because you know what I'm saying. The only bad publicity is no publicity.
right.
So what they really feel down in their heart, that's another matter to
Yeah,
explore.
sure, sure, true.
So, but I don't think any employer, if you're true and you know your numbers as an employer, you don't want to be any part of this. Uh,
So tell us, what are some of the challenges that your clients have faced recently? Especially, I know you said you've been doing this. We talked earlier, and you said you've been doing this for 20 years. So you were around before Obamacare came into being. So tell us what the challenges are that your employers have faced since the advent of that heinous law.
well, I mean, I particularly deal in the space of maybe the 5 to 25 is my main base, but I do have an employer that's 300 people,
Wow.
300 employees. But you know what? She always offered health insurance prior to the ACA. One thing, biggest challenge for her is a lot cheaper,
Right.
and so she has about the same employee pool on it, but her costs have gone up in order to keep
Wow.
that same employee pool, because those are mostly the management and the people that have been with her for several years.
Yeah.
Most of my base is a small group, and a lot of them do have had health insurance prior. So their number one challenge is costs. The added taxes to the health insurance, whether you're a large employer or not,
Right.
is put in there. Now, what the ACA did, probably about, I'd say around 2012, when it really came into like, all right, here's what we're doing, is it for even the small employer, it lowered their base, their risk pool, where they would have 10 employees on there. Some of them got off because they
Right.
were, hey, I can go and get health insurance for quote unquote free. Y'all know nothing's free. Um, so their 10 employees went down to 5.
And what
Well,
does that do to their rates when that happens?
exactly. Their rates are affected by
Yeah,
it.
sure,
It
sure.
just is. I mean, we all know that, insurance is a risk pool. You
Right.
know, it's based on how many people are in there, age, all that good stuff is
Pre-existing conditions.
factored in. Hey,
Yeah,
well, yeah. I mean, what insurance companies tend to do is they back end load. They sit
sure.
there and give you a risk factor of 1 right off the get go,
Right.
and then the next year, uh-oh, now your risk factor went up, and you see a 22% increase.
Well,
Okay.
that's how it has to be, though. I mean, that's how it has to be. And so the Obamacare mandate that all pre-existing conditions be covered. I do a video talking about the problem with pre-existing conditions, and the way I see it is that lots of people have pre-existing conditions. In fact, there was the tweet that was put out, or a news article that I read, where the ex-senator now, Claire McCaskill, asked a question to this town hall about who here has pre-existing conditions, and 97% of the people in the audience raised their hands. Oh, I've got a pre-existing condition, and the problem is that lots of people consider, acne as a pre-existing condition. Lots of people would consider, toenail fungus as a pre-existing condition. And the thing is, what I ask in this video, at the end of the video, is what pre-existing conditions ought to be covered by health insurance. And my take on it is very, very few. I mean, even my pre-existing conditions that I have high blood pressure and I have a cholesterol issue. I don't have high cholesterol, I have low good cholesterol, but I take medicines for these things. The medicines cost me $80 a year between the two meds that I take. That's what it costs me to manage my two conditions. I don't need health insurance to cover those things, period. And I probably never will need health insurance to cover those. That's not what insurance is designed to do. And so by mandating these pre-existing conditions, I think that really helped lead to a lot of what your employers, your clients are experiencing in these rate increases. Even though, and especially it's exacerbated by the fact that people left to go get the free ACA or Obamacare policies, which we know they're not free.
Right. I'm totally with you on there. I mean, I don't hate to say it, but, a lot of people, before, I mean, even prior to the ACA, yes, we have pre-existing conditions covered, I mean, not covered, but, or rated,
Sure.
We'd see several that, with certain insurance companies that would rate at 0.5, but one thing is, I don't want to sound heartless or anything like that, but a lot of people say, I would tell them, I go, get in a car wreck and then go to your local Allstate or wherever you want and go, hey, I was just in a wreck and I need to get insurance to pay for this wreck.
Right. Yeah, try that. Try that. Yeah, I need surgery this year, so I better get insurance. That's not how insurance works, and that only drives up the cost for everyone. So tell us what you do, because I know you're an out-of-the-box thinker like I am and like the other guests I've had on this podcast. So tell us what you do differently for your clients that doesn't involve the same old traditional health insurance model.
Well, I mean, right now, we're dealing with a company that is primarily they're MEC plans, which are minimum essential coverage plans. And basically, I've worked with this company over the past year to where, all right, because we all know it, all right, people like having health insurance. They do.
They do.
But they hate to pay for it. That's the biggest.
That's right.
For it. But most people hate paying for the bells and whistles.
Right.
Okay, let me tell you this, just a little bit before, is prior to the ACA, the state of Florida had 33 state mandates. Had 33 mandates that every insurance company had to adhere to. If you were going to do business in the state of Florida, you had to have chiropractor, you had to have well baby care, you had to have this. Whether or not you have children, you still got to pay for well baby care. So there's 33 mandates that were already in the state of Florida health insurers had to adhere to. So you're paying for bells and whistles that you didn't. Why do I have to do this? It's kind of like with if I can use this example, and I tell people this all the time, well, I can't have kids and they're on a group health insurance. I go, listen, it doesn't matter. You can sit there and I'm going to put it to you this way, and people might be, cover your ears, but you can sit there and take your uterus out and slap it on the CEO of a health insurance desk and go, listen, I cannot have babies.
It won't matter.
Sorry, ma'am, but you're still going to have to pay for that maternity coverage until a certain age, and then it drops off. So it doesn't matter.
Wow.
to your point, so these minimum essential coverage are ones with some copay. Some of them don't even have copays, but they have a little bit of catastrophic in there. But I'm also, I also have our voluntary benefits pool company that we use. We basically, they can build their own plans.
Yeah.
Without, I don't need that bell, but I want that whistle, or I don't need that whistle, but I want that bell. So I have people who are just doing telemedicine, and which is I'm a big proponent of that. It's all the rage.
Yeah.
And actually had someone use it. They went to the doctor and actually didn't get better and used telemedicine, and they were prescribed something and it worked. They were actually cured in a couple of days. So I'm trying to reduce people's costs.
Yeah.
And keep being mindful of their need as well. Because what used to cost $105 back in 2010 to have a child policy now is $200. It's crazy.
Insanity.
But you and I both, it doesn't matter. We could sit here and talk till we're blue in the face. People still want health insurance.
Yeah.
They do. But they don't understand. They understand the health part, but not the insurance part.
That's right. Well, before the ACA, prior to the ACA, really prior to 2000, which is when the trend started. I write about this in my first book, The Guide to Buying Health Insurance and Healthcare. Prior to 2000, deductibles were low. They were extremely low. And so we didn't have health insurance back then. What we had was prepaid health care. Anytime you go to the doctor and you have a $5 copay and that's it, that ain't insurance, okay? That's somebody else paying for your medical bills. Well, when the health insurance industry started raising deductibles and out-of-pocket responsibilities, they started transitioning to a true health insurance model. And I love it when I hear people say, people are functionally uninsured. And I'm saying, what does that mean, functionally uninsured? I mean, does it mean that your insurance doesn't cover everything down to the windshield wiper blades anymore? Well, it never should have in the first place. And that was a trick the insurance industry used to get everyone hooked on health insurance. To another point that you just made, though, I think it's very interesting, and I love taking people on when they complain and moan and whine about what the free market, what capitalism has done to healthcare, and what they mean is to health insurance when they say this. That capitalism has done nothing but screw health insurance up, and that's not capitalism. Having a state that has 33 mandates on what a health insurance plan can and cannot do, including covering pregnancies and making men and women who cannot have babies or don't want to have babies, making them pay for people who want to have babies, that's not capitalism. That's not a free market. That's crony capitalism. Those are state regulations and state laws designed to keep who happy? The health insurance industry, because they get everybody paying for this small subsegment of the population. It goes back to the birth control argument, and I wrote a post about this on my blog about the politics of the pill. The governor of New York State wanted to mandate that health insurers cover birth control. Are you talking about birth control that can be had for as little as $10 a month, Governor? I mean, this is outrageous. It's insanity. And I would suspect, I would make the case that the health insurance industry is behind these laws because, hey, if I can get you to pay me for coverage for something that you could go get for $10 a month, I'd love to get you to pay me to have coverage for that, even though you don't need the coverage. But that's where we are in American healthcare. So what you're saying, Raul, is that you take the extra time you are giving of yourself and your company and your business by instructing your clients, by taking them outside this box and saying, hey, look, don't do it this way. Do it this way. You'll save money. I mean, how are you not a gazillionaire? I don't understand.
Well,
tell us.
I mean, you know the answer to that as well as I do.
I do.
Because, like, a lot. They used to be called back in the day skinny plans.
Yeah.
So everyone who knows about skinny plans, stuff like that, except we have a couple nuances in ours.
Yeah.
But like I said, like you and I both know, like the more expensive one does have hospitalization in it, but none of them contain like a surgical schedule. But we have other plans that they can actually put some surgery benefit in there. And what I've learned from you and from your other guests and people, just because I constantly read. I mean, I get newsletters via email and all that stuff, just on the market and trends and HR and all that stuff. But what I've learned, is like, hey, cash is king. It is.
Yeah,
I mean,
yeah,
cash
absolutely.
I use it with my own doctor. I mean, I'm not here.
Absolutely.
And you know what? I get my doctor. He goes in there. He goes, Raul. He goes, give me $40, and I give
Yeah.
him $40, and then I'm going to go play at a restaurant later that night, and guess where he is?
Yeah, yeah, yeah.
Spending my $40. At paying
What
cash,
goes around comes around, right?
which is great. And he comes see me. He goes, no wonder you're in the mess you're in. Come see me next week. Um, but
And,
I
and
don't.
and the typical reaction would be, "Come see you next week." What, and give you another $40? My health insurance ought to cover that.
Look,
Yeah, it's the health insurance industry has done a real number on Americans' idea of healthcare and what healthcare ought to be, and I applaud you for standing up to them. I applaud you for trying to lead your clients at least out of Egypt and show them the proper way of how things need to be done,
well,
and so things save money.
Well, yeah, but I mean, like even the ones with health insurance, and I sit there and we got to do, they're on a group plan, and we have to move them to a certain to a deductible. I have plans that can come in so they can sleep at night because of that high deductible. But I've also done some homework where I compiled a list of places such as MRI places and stuff
Yeah,
like that to go, listen, your MRI under this high deductible plan is going to cost you X amount of dollars
yeah,
because it falls under the deductible. Or you can go here and pay cash, and it's going to cost you a fraction
yeah,
of it. And there's
yeah.
more and more of those places popping up for EKGs, EEGs that, hey, you know
Right.
what? We don't want to mess with the health insurance. You come in here,
Straight up.
I hate to say it, but it's almost like you have to go there. Yeah, you got to go down to the street corner and get an MRI. Hey, man, don't go use where that place tells you to go. Come over here. Go down on 7th Street and get yourself an MRI for X amount of dollars. They'll
Right.
hook you up. It almost sounds that way.
Well, the movement you're talking about amongst healthcare professionals is called direct. It's called DPC, which many people say stands for direct primary care. The primary care physicians like me tend to have a bias towards that. I like to call it direct patient care, though, because it's not really limited to just primary care physicians like internists and family medicine docs and pediatricians. Really, specialists can do this too. And a living example is right there in your area. Dr. Ellen McKnight is a
Mm-hmm.
rheumatologist who doesn't accept most health insurance. She doesn't accept Medicare, which most rheumatology patients, are typically elderly and on Medicare by the time they have rheumatologic problems. So she doesn't accept any Medicare. She opted out years ago. She's very active on Twitter and social media.
Yep.
She speaks and she's great. She's awesome. I spoke to her, the Escambia County Medical Society last year at her invitation. But Ellen is great. She's making it. She's doing great. She's got her own practice. She doesn't accept health insurance. Her patients love her. They pay her directly. Why can't it work across the board? Absolutely.
Yeah, and that's it's the freedom of it.
Yeah.
It's we're slowly but surely seeing it in every industry. I mean, like they say, Obamacare took over 1/6 of the economy. Do you think that's going to stop there? And but we all know it's all political.
Yeah.
Like I explain this to some employers this way, and because they'll go, man, I cannot believe this is happening, and so and so. And I said, well, believe it. I go, just think, if you were a tire shop and you sat there and said, hey, I sell tires for $5 a pop, so your to tire, which we all wish that would happen, but just to keep numbers simple. All
Sure.
right, so total set of tires is going to be $100.
Yeah.
All right, you're going to be like, great, hey, I'm out the door with it. All right. The next year, the government comes in and says, hey, guess what? Based on the national transportation and the highway, whatever the acronym is for the highway people,
Yeah.
we are now offering everybody $1,000 per year to outfit their car with tires.
Yeah.
Now, if I'm a tire
Yeah.
store owner, that same customer that came in and bought it at $25 to pay for it, it's going to cost how much per tire now?
Well,
Two
look at
hundred,
student loans.
250.
Look what student loans have done since the
Well,
government
that's what
took
I'm
over
saying.
student
So now
loans.
that $25 tire just became $250 because the government's giving everyone that qualifies for the benefit. Now, someone who doesn't qualify can say, last year it cost me $25 to get that tire.
Yeah.
Now what do you mean it's cost me $250? Well, man, the government's giving $1,000 handout for tires to everyone that qualifies.
Right. That's right.
I'm a business owner. I'm going to take advantage of it.
Sure, of course. Absolutely.
And I mean, that's what happened with I don't want to say healthcare, with health insurance, because that's another pet peeve. I cannot stand it when I hear access to healthcare or the healthcare this. It's got nothing to do with healthcare. It's about health insurance.
That's right. That's a fact.
The government got into the health insurance business.
Well, you said something.
In an extent, they always have been.
Sure.
Just like they are in every industry, they are to an extent. But to demonize from health insurance to health care, where I don't have access to health care, I was like, oh, so yesterday you didn't have health insurance, but you couldn't walk into that doctor's office?
It makes no sense.
That's the access to health care. The ADA got involved in that years ago that said, you know what, every physician office and dentist office and all that stuff have to have ramps.
That's right.
That improved access to health care. There's your access to health care.
There's your access to health care. Now, Uber exists now, too. If you need a ride, Uber exists, so you can call one of these Lyft services, one of these driving services.
Actually did more for access to health care than the government did.
Yeah, they're cheaper than ambulances. I write about that in the book too. You made a great point though, and I want to close with this because we're almost out of time already. But I want to close with saying that you made a point, and I want to expand upon it. We've got to fix this, but who is going to fix it? As I point out at the end of my first book. And I plugged my first book many times. But I pointed out at the end, it's patients who have to fix this. Patients are the ones who are most impacted by this. Patients are the ones now, thanks to high deductibles, who are having to pay for their healthcare costs. And so our job, from my healthcare physician perspective, from you as a health insurance and employee benefits expert perspective, what we need to do is educate patients as much as we can about how they can save money. And so I applaud your efforts on doing that through your clients, through employers, because you know what? I know it's got to be costing you business and money. I mean, you could make a lot more money, I'm sure, by selling them the snake oil gold-plated plans with the higher commissions and what have you, and make a lot of money by just doing the bamboozling. But by being honest, I think it's brokers like you and physicians like me and my crowd who are going to help change healthcare by changing the way people think about healthcare.
And I appreciate that. I mean, I even tell everyone that works with me, I have 8 employees that work with me. We never chase a dollar. We just don't. I mean, that's not the way my mentor brought me up in this business, and I pass that down. As far as fixing it, yeah, you're correct. It's actually the consumer that's going to fix it. I almost, like me on pre-existing conditions and stuff like that, where that's the big driver of cost. I'll be honest with you. I mean, it is. It's the biggest driver of cost, where I almost have a fix for the whole darn industry as a whole. Whereas there's some pre-existing conditions that should be covered, like a child that was born with something, or someone that developed something naturally. But let me tell you this: Obama, even on the Unaffordable Care Act, as I call it, they'll ask you how much you smoke. Okay, are you a smoker or not? But they won't ask you if you pick your liver every night. Okay, so you could sit there and drink a fifth of whiskey every night, and you're going to get rated the same as a jogger. But if you smoke, that's totally bad. I always believe that they should have done 2 separate risk pools. They should have kept the healthy alone, and then if they want to create a type of risk pool to help out people with pre-existing conditions, where the government could get involved in that, just to kind of help subsidize. I'll be honest with you, that's what I thought they should do. Yeah. Where there's 2 sides of the house, but it's neither here nor there. It's a roller coaster. That's one thing I love about it. I'm not a merry-go-round guy.
Yeah.
This business is a roller coaster. That's what I love about it. The government.
Well, we're out of time, so okay. I got to cut you off there. Sorry, we are out of time. But I want to say how much I appreciate you coming on the show. Thanks so much, Raul, for your time. And we'll do this again. Believe me, we have lots more to talk about. It sounds like both on and off air.
Man, I'm number 6. Sad.
Well, it just so happens we'll make you a lot more numbers. How's that? But thanks again for coming on. Thanks again, folks, for watching us, and you can check us out again on iTunes, on SoundCloud, on my blog, on YouTube, and through Mike Church's CrusadeChannel.com. Till next time, everyone, stay healthy. Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.